Okay, yeah. So I'll start with that video before I introduce anything. I apologize for the quality of sound and image. It's an old video and it's the best one I found, but it paints the picture.
どういたしましたか？
Yeah.
はい。
We need a doctor for emergency room.
It's not an emergency. I just heard
わかりました。じゃあ、これから診察の準備をいたしますので、番号札を取って、カルテを記入して、向こうに案内いたしますので、はい。
Which number?
はい。手続き終わりましたら、こちらの方からお呼びしますので、ソファーの方でおかけになって待っててください。どうぞ。
We're not going to another hospital, so whatever you say is okay.
じゃあ、お大事にしてください。
Could you put that back in the garage for me?
はい、どうぞ。
そうですね、ここにですね、亀裂骨折の疑いがあるようですが、まあ、テーピングして。
日本に何年いるんですか？
In this guy?
いるんですか？そうよ。
All right, for those who didn't recognize it, this is a little piece of the movie Lost in Translation. I think it was released about 15, 16 years ago. It's a bit funny, but it's also reality for many of us who've been in hospitals away from home. And for many Australians, that's every visit to the hospital. It's really hard to navigate a foreign medical system, let alone if that one is in a language we don't speak. So I'm David Silvera. I'll be talking today about CALD Assist. It's an app we developed to try to improve communication with patients from non-English speaking background when interpreters are either not available or it's just not practical to access an interpreter. How did we start with this project? And I think Ben's presentation was perfect to introduce this because it really presents the background that we had when we started talking about this project. There's a gap. There's clinicians that really want to use different apps to communicate because interpreters are not always available or not practical, and communication apps, machine learning app, translation apps are not don't provide have risks, don't provide the perfect interpretation. Australia is becoming increasingly diverse, so this issue is not going away. If anything, is getting bigger. We started with the project in Victoria. We built this in collaboration with Western Health, and just to paint the picture, in the city of Brickmank, which is where Western Health has one of their hospitals, there's about I learned yesterday that it's probably more like 110 or 20 different languages, still a big number of different languages just in that portion of Victoria. Over 60% of people don't speak English at home, and over 20% of them don't speak English at all. Non-English speaking patients, of course, find it very difficult to access timely care, and even when they do, they're not sure that the communication is being accurate. And clearly, ongoing communication is crucial to avoid medical mishap. So this project really started with speech pathology in around 2010, 2009. A group of clinicians from Western Health realized that patients were at risk of dehydration, choking, and poor quality of life when they came to their assessment. When they wanted to do a quick assessment, they couldn't really understand, and they couldn't access interpreters as soon as they wanted them. So they decided to start creating a little quick flip chart and answering some of the questions. This is what people do when they don't have other options. They create flip charts with some of the basic words they need to communicate to complete that assessment. And in that case, they did it in the 10 most common languages they used, including instructions, photographs, and it was no perfect, but in their case, it did increase assessment completion from 30 to about 80%. Sorry, I just need a little bit of water. So from there, we decided to convert this booklet into CALD Assist. The idea was to create something that was safe, provided accurate interpretations without the risk of machine learning-based interpretations. In 2014, we started with the idea of creating an accurate, easy platform to facilitate communication with patients and improve service delivery. The main difference with the other apps that were, for example, Google Translate, that now we all know a little bit more about it, is that these CALD Assists provide multimodal interaction, so it's images, videos, sound, text, and not only the text. There's no Wi-Fi connectivity, which means the risks related with not being able to connect to internet, not being able to access the app are completely reduced or removed. There's no data collection, no data tracking, so there's no need to put information about the patient. Nobody needs to know how it was used with the patient unless we report it in any other way. There's no people behind it listening to the conversations or to the speech. So it's standalone app. You download into the tablet and you use it. There's no need to type in conversations. Yes, you can search for phrases or for words, but it saves time in the need to type the full conversation that then needs to be translated. Text-to-speech, that's not really a difference because both Google Translate and ours, they both have text-to-speech. And the most important of all for us was inaccuracies in the interpretation. So we needed to reduce this to 0. Machine learning interpretation is improving and it will continue improving. In some languages might be up to 95% for us, 5% in a medical setting is still significant. So we wanted to bring this to 0. So what's CALD Assist? I'm going to show you another little video.
The CALD Assist app is really an innovative way of helping facilitate clinicians to communicate with patients from non-English speaking backgrounds when we can't access an interpreter. So it's a multimodal app. It includes 11 different languages and the nursing version includes over 150 phrases. And they're phrases that are really designed to help that basic interaction between nursing staff and patients.
So the staff are really excited to be able to use this app because it means that they don't have to get an interpreter just for simple questions. They can actually just go to the app, get the iPad, open it up, get the right language, and then ask the patients the questions. We can use phrases that the patients understand, and the patients can point to the ticks or the crosses. They can see the pictures and then they can communicate back to the nurse.
So CALD Assist is an app that was developed for clinicians to use. So as you could see, it supports more what someone was asking around or commenting, I think here, is the one-way communication more than anything, but it provides the possibility for patients to respond, and it gives them a little bit more than yes and no answer options. If they need help, the clinicians can go through a series of questions to try to understand what kind of help they want. But we wanted to develop something that was relatively self-contained, that didn't allow or didn't give patients the option to start a full-on conversation where clinicians were going to be completely lost. For that, we have interpreters. So it does provide the ability to say, I'm sorry, I don't understand. I'm getting you an interpreter. I'm calling an interpreter. The interpreter is coming tomorrow. So this is for in conversations when it's not practical or it's not possible to have an interpreter, but we still have to communicate with patients. The development was divided in two stages. As I said before, it started with speech pathology, so it just made sense to start with allied health. So we did 5 different disciplines: physiotherapy, OT, speech pathology, dietetics, and podiatry, with the 10 main languages that were needed for Western health. The app includes 95 phrases that are focused mainly on assessment, because that was the need for allied health. And I'll go into a little bit more detail how we came up with these phrases and the needs, etc., in a minute. During our evaluation, that was around 2015, nursing staff communicated the need for them to have a similar app. Of course, nursing staff required to assist patients with very different kinds of interactions. Their daily care, it's not only assessment, and the interactions are of shorter duration and more often than those of allied health. So the decision was to develop a second version of the app. It's not really a second version. I often talk about it as 2 different apps. It's the same app with nursing included as a new discipline. So in 2017, we developed that part of the app. We decided to include English as an 11th language, and that was also a request from staff that said many times we have patients who speak basic English, and this might help us communicate with them, or they have hearing impairment or cognitive impairment, and something in English could help us communicate with them. So we included that as an extra language, an extra 150 or more than 150 phrases specifically for nursing. And because this is about daily care, we had to divide them in different sections. So not the 4 simple sections for focus on assessment, but pain, hygiene, mobility, nutrition, etc. So let's look a little bit at the features. So this is the first screen of the app. It has the languages. Here are the 10 main languages we had at the beginning. You'll see in a later screen the new version that has English. And this is the main screen of the app. On top, we can see we selected the discipline, nursing. We have Macedonian as a language. Feedback, this was something we used during the evaluation, mainly to get feedback from clinicians, but it's been removed from the latest version of the app. And a search option for people who just want to look for a specific phrase. On the left, we have the different sections for each discipline and the phrases. So if you choose one phrase that it's in blue, it gives you the English version of the phrase, the translated version, and in this case, a few different images. Those could be videos, depending on the case. At the bottom, we can play the audio, the translated audio. We can have a few answer options, because we also want to give patients the opportunity to answer, and depending on the question, they might have more than yes or no. And even if it's yes or no, we want to give them the option to point to the answer in their own language without having to tell us the answer, which we might not understand. And follow-up questions. So in some cases, and I'll show you an example, I think here. No, I think this one is in Spanish. Have you lost weight today? They can say yes or no by pointing to that. We can open the answer option in their own language. But if they say yes, we can go to the next one. How much weight have you lost? And that's basic communication that really helps nursing staff communicate in those short interactions. All the phrases were professionally translated and verified by interpreter services. So we know that there's no mistakes on the interpretation, at least. Well, it was verified by multiple people from interpreter service, so it's at least as accurate as the interpreters are. have a little video. This is gonna show it. It goes. It's a little bit confusing, so I'm just gonna try to explain how it's going, because it doesn't have a mouse, so you can't really see where I'm clicking. But I'll take you through it. So this is the main screen. You choose the language, and yeah, here we choose English just to make it easier for you. You have all the disciplines on the left. You choose a discipline, dietetics. You have the different sections and the different phrases. You can change to a different discipline, and it's the same structure for OT. And I think I'm gonna go to nursing in a minute. And you can see there's a lot more available there. Pain, general admission, all the phrases, etc. This is the hard way to go through all the phrases. You can always go to the search option that I'm gonna show in a second. So you choose a phrase, and then you can scroll through some of the different options. You can play the audio, which I'm not gonna play, and you can have the answer options, yes, no. Again, this is in English, so you can all understand, but it's very similar in any other language. And that is the search option. You look, pain, you find pain, etc., etc. All right. App design. So went back. From now on, I'll be talking about the research part. How did we create this app? How did we evaluate this app? So everything started with a user needs analysis. All the decisions we took were informed by clinicians. The features, the phrases, the design of the app, how it works, how we interact was all informed by both allied health clinicians and nursing staff. The languages that were included were, of course, informed by interpreter services. So we worked together with Western Health Interpreter Services to identify which were the languages that were more important to include. And from that, we designed the app in-house. So the user needs, that is the main part of this initial stage. So the aim of that user needs analysis was to understand what is the context of interactions, what kind of device we needed to include, what kind of app. Are clinicians standing next to the bed, at the end of the bed, what kind of interaction are they having? Can we have a screen that is high? Do we need to be able to bring the screen down to patients? The size of the screen, etc. Communication needs, what are the phrases? What are the main phrases they wanted? What kind of communication they wanted to have with patients? And of course, out of this, we got a whole range of communication needs, but we needed to narrow it down to what are the priorities. We could have included 3,000 phrases, but then what does that mean for the practicality of the app? So we had to narrow it down to what are the most common phrases or the more urgent phrases, what can't wait for an interpreter to come. What were the main challenges? What are the challenges both in communication, but also for the clinicians to be able to use an app? And from there, the technical requirements. So this was done through focus groups, 9 focus groups, both with allied health and nursing staff. Interviews with patients, also trying to understand what are the needs for the patient perspective, even though this was a tool that we were aiming to develop for clinicians. We wanted to understand how would this help patients and what would patients would like to have. And 85-hour long observation sessions. So in these observations, we were trying to understand a little bit better how the interaction was happening today. And it's what Lisa answered just before. We were able to see what clinicians are doing today when they can't communicate with patients. And it's that the gestures, the simple language, simple English, the relying on family members or looking for another clinician that could help them communicate. And all of those behaviors, that's what we were able to observe. And then, of course, we had follow-up conversation with staff. After we had all the interviews and the focus group, it took us months of conversations with the staff that participated and didn't participate in this focus group to narrow down the functions, the functionalities, the phrases to something that was really relevant for them. From there, we developed the app. We decided to build it in an iPad for both practical reasons and also it fits within the needs. Since then, we've been having conversations about the possibility of redeveloping it into different platforms or changing it so that we can cover different ground. And that's ongoing. And then we had the evaluation. So again, because everything was done in 2 different stages, the evaluation was also done in 2 different stages, one in 2014, the other one in 2017. So let's look at the evaluation. Both evaluations were very similar in the sense that they were both before and after evaluations. They both had qualitative and quantitative data. Just the context of the interactions are different, hence the evaluations were different. Allied Health was focused on assessment, so for 4 months we collected as many assessments as we could from non-English speaking patients, a total of 45. We noticed that about 50% of those assessments were not completed, and most of those were because of barriers in communication, in language. And from all of those, only 10% of the assessments, the staff reported they were confident that the communication and the patient understood what was happening and that they actually understood the needs of the patient accurately. In nursing was a little bit different. Here, the interactions are a lot shorter and limited, so we went with the observations, 85 hours of observation. In this case, we looked at English-speaking and non-English speaking patients to try to understand the differences. So we didn't really want to look at the boundaries, but what is the difference in the care provided between one group and the other group. 50% were English-speaking and 50% non-English-speaking. There was believed that the number of interactions and the length of interactions between English and non-English speaking patients would be very different because they couldn't communicate. We didn't see that. There was no significant differences in how long and how often clinicians or nurses were interacting with patients. But we did see that the confidence as rated by staff on the patient's understanding of the interaction and the success of interaction was significantly different. So basically, they were interacting as often. They just didn't think the patient understood the interaction, and they didn't believe the communication was successful at all with non-English speaking patients, of course. Then the live trial following this, we introduced the app. We didn't force anyone to use the app. We just asked them use it as often as you believe it's useful, provided a lot of reminders that the app was available and education on how to use the app. But they could choose if they wanted to use it or not. With Allied Health, in 6 months, we had 32 post-assessments, which is comparable to the 45 we had before. 1 patient survey, that was very, very challenging. Patient surveys and interviews, we can only get them when there was an interpreter available. If there was an interpreter available, the rule was you're not going to use the app because there's an interpreter, so you have to use the interpreter, which meant we were only able to have these interviews in the next appointment with patients, which was about a week or more after the first assessment. By then, most patients didn't remember having used the app at all. We take this as a positive because if they don't remember, it means it didn't interfere in the care. But in terms of results, it didn't give us a lot of information. 1 patient remembered and gave very positive outcomes. Everyone else didn't remember. We didn't have surveys with staff, focus with staff, and app log analysis that told us a little bit more on how often and how the app was used. With nursing was different. Again, we did our observations, just 55 because we weren't observing English-speaking patients. That didn't change, just non-English speaking patients. Patients was still challenging, but a lot easier because they were at the hospital for multiple days, which meant we could go and ask them about their interaction with the CALD assist, and they were able to answer when we had an interpreters. Again, focus groups and app analysis. So let's look at some of the results. Starting with Allied Health, as I said, we had 32 sessions, mainly speech pathology, and a total of 128 phrases used. Most of them were, I can't speak your language, I'm going to find an interpreter to help you communicate, and things around pain. Functions is choosing the phrase, playing the audio of the phrase, and looking through images. The actual results, we did see a significant reduction on the time it took to complete assessments from about 42 minutes to 15 minutes with non-English speaking patients. The complete confidence of understanding and success of the interaction went up from 10 to 42, which was significant. And I don't have it here, but the completion rates went up from 50% to about 82%, which also was significant for us. And most of the staff reported that it was very easy, and they were very happy with the app. In terms of nursing, as I said, this was shorter interactions, but we got almost 400 sessions of app usage of about 2 minutes in length. So the length between before using the app and after using the app didn't increase considerably. At least it was not significant in our statistics. These were the main languages. Of course, in their case, they have a lot of Vietnamese patients, but we can also see the English was used quite a few times. Most of the categories they were interested were around pain, continence, and hygiene. General questions were more around, do you understand? Do you want an interpreter? I'm gonna get you an interpreter, etc. Phrases, again, the most common phrases were around pain, do you understand? And I don't speak your language, etc. Our observations and surveys with staff, during the 55 hours of observation, we saw 224 interactions. They used the app in about 33% of those interactions. In the other ones that they didn't use the app, staff reported that either it wasn't needed, the interaction they had was short and they could do it without communicating with the patient. They forgot they had the app and it would have been great to use it, but they didn't remember. Or they did remember, but the app or the tablet was not available next to them and they had to go to the office or to the other desk to collect it, and they just didn't have time and they decided to do what they needed to do without communicating with the patient. Most of the feedback was very positive. And in our statistics, we did see significant increases in staff confidence of the interaction, significant increases in the rating of the success of the interaction, and significant reduction in staff frustration when they communicate with patients. I don't think I reported, I didn't add any of the results with patients, but it was really, 90% positive staff feedback from patients as well. They were very positive about the use of the app. Family members were very, very positive. We didn't ask family members, but their general feedback was that they were more comfortable to go home knowing that the patients could communicate or had at least an alternative to communicate with clinicians. This is a little bit more just to show you the details on the results, the confidence and the success of interaction. So on top we have the baseline for English-speaking patients, and the baseline for non-English speaking patients. So you can see there's a big difference as rated by staff on the success of interaction, with English speaking patients being rated a lot higher. Once the app was introduced, we can see, again, we have when the app was available but not used by staff because they forgot or they didn't think it was needed. The rating was still significantly low, or lower than English-speaking patients. So the app was available, they didn't use it, they didn't think the interaction was very successful. When they decided or remembered to use the app, the success of the interaction increased significantly to levels almost comparable to those of English-speaking patients. So that's when we start considering that the app is really starting to close the gap between the care that is provided to English-speaking and non-English-speaking patients. And there's still work to do, but these differences, as we can see them, weren't statistically significant anymore. Focus groups and interviews. We noticed that the communication, or they mentioned communication, was easier, more accurate. There was no resistance by family or patients. There was some resistance by staff to do the change of behaviors to what they're normally used to do. But we actually noticed that those staff members that were resistant at the beginning seemed to be the ones that were more willing to use the app at the end. And it wasn't the cohort of people, it wasn't the younger populations as we expected. It was actually the older population, the older nurses that had been around for a while that found it very useful and thought it's great to have an option. Main challenges: familiarity. It was a learning curve even though the app is easy to use, it took a little bit of time for them to recognize which phrases are available, which ones are not available, where they are, and how to find them quickly. There was some missing content, phrases that they wanted to include, many of which are now part of the app, but others that they really wanted to use once during the whole 6 months, and we decided just for one usage. It's not an emergency question. It's probably not worth including it at this point. Location, out of sight, out of mind. If they forgot the app was around, they wouldn't use it, and as we could see, they wouldn't have a successful interaction. Time limitations, again, they wouldn't go and pick up the app if the tablet wasn't available for them. Patient cognition, in many cases, there's more than just language. So with patients with cognitive impairment, sometimes the app was helpful if they used English, but in many cases, it really didn't make a big difference. And contact precautions. We have a tablet in the ward, so we needed to make sure that it fitted within the contact precautions unit requirements. The app or the project has won a few different awards, and the app is available in the App Store just for iPad to download, so it's free and anyone can use it. Not for the iPhone. The reason, that's the question we always get, but the reason of that is because of the size of the screen. So the iPhone is just way too small. In our conversation with staff, they told us that their preference was a big tablet that patients could actually read, and not a phone. So it's not available for iPhone. Thank you.